I wanted to follow up on the staffing question. Everybody wants more staffing, but I'd like a date with Angelina Jolie, but it ain't going to happen. Can that be stricken from the record, Mr. Chairman? But you know what I mean. I mean, we've got enormous staffing problems, and to say you've got to have a certain, it seems to me that it opens up liability questions, and it puts the staff under a lot of strain because it's just unrealistic right now. Mr. Blum? I understand it would be better, absolutely, but you can't conjure people out of thin air.
One of the things that we see in experience, see in our data, but also see in our travels is that we are seeing a stronger workforce than we had 2 years ago. We are seeing fewer contract dollars, fewer traveling nurses, fewer traveling physicians due to just more stable workforce. And so we want to build upon that. And the challenge for us is that we see clearly in our data that when nursing homes don't meet set standards, minimum standards, the quality of care is horrible, that harm happens. And so our goal is to really find the right balance between making sure that nursing homes can fulfill the requirements to the Medicare and Medicaid programs. They can have a growing staff, but we see the best solution to this tension of better quality outcomes and better access through a growth in consistent staff. And so our goal is to send a very clear signal again back to nursing homes to say this is what's required to meet basic Medicare and Medicaid requirements. And if we don't have that, we're going to see less access, we're going to see more facilities closed, we're going to see worse quality outcomes.
And you're going to have fewer beds for veterans to go to.
We believe
you're not serving veterans if a home closes because they can't meet the staffing standards because they can't find the people. Let's get real here. Don't tell me you're improving service to veterans when you just said we're going to see nursing homes close.
We don't think they're going to close.
You just said that. Didn't he use the word close? Yeah, you did.
Well, that was misspoken. What we want to see is a nursing home force that is more stable, that allows nursing homes to continue.
Nobody disagrees with that. The question is, how do we get there?
Yeah.
And are we in the process of getting there, setting unrealistic standards that will, in fact, lead to nursing home closures? That's the issue, and I think has to be, you have to address, it's not enough to say, we're going to have a good staff and we're going to have enough staff. I want to hear how you're going to make that happen, because we're losing nursing homes generally in Maine because of a lack of staff. Yeah. And so let's have some programs to retain, raises, training, career ladder, whatever it's going to take. But that's what I want to hear. And to start with the what I believe may be unrealistic standards, it seems to me is backwards. We should start with the programs to build the staff and maintain the staff that we have, then talk about increasing.